I'm Dr. Arun Chamria. It is my privilege today to speak on this topic of same day fixed teeth with dental implants on one side, and on the other side what had been the procedure wherein it used to take a few weeks to few months to put the teeth over the dental implants. Now, the advantages of putting it on the same day are very obvious. Every patient would like to get the teeth on the same day, they are very happy. And today how the procedure is done is just, it is tube, is without almost any surgery. You just make a pinhole and you can just put the implant, which takes hardly 5 to 7 minutes. So, even if you have certain medical conditions, this would be a much more safer thing, one. Number two, you will find that when you are putting it on the same day, the healing is very quick. Third, you will find that usually here what we use are very thinner implants. Now these thinner implants usually of a single piece, and therefore hardly 50% of the bone has to be drilled compared to the conventional or the implants where there is a broader diameter and which are loaded or where the teeth are put after a period of few weeks to few months. Now, if you see in that condition, because they are two pieces, when the first piece is put and the second piece is embedded in it, you require a huge dimension, and that minimum width of that or the diameter has to be around 3.25 millimeter. So otherwise, it is very difficult to put a shaft. Now that shaft which goes inside, on which the tooth is loaded, is hardly 1.85 millimeter. So really speaking, if the strength of both the implants are concerned, that is, if you are using a 2 millimeter single piece implant which is immediately loaded, put into the bone, no surgery, immediately the tooth is put, compared to the other side when you have drilled a big hole, put that implant and then wait for 3 to 6 months, and then you put a shaft over which you are going to put, or we call abutment, where you are going to put the tooth. Now basically the strength of both are almost same, because this is 1.85 millimeter, this may be 2 millimeter. But here the hole which you are making in the bone is almost 3.25 millimeters. So you can imagine how much of your natural bone goes away. So this is one part. Second part, the success rates and all are almost same in both the cases. But in the event of those 5 to 10% cases which fail over a 5 to 10 year period, you will find that in these implants where you have made a big hole into the bone itself which remains is quite less. So if you have to, for any reason, if the implant fails and you remove the implant and you have to put another implant, you may not find sufficient bone to put it. So therefore, in the event of those 5 to 10% failure cases, you may find difficult to retreat. While in this case, you have made a hole very less, instead of 3.25 only 2 millimeter. Now because you have made only 2 millimeter hole, you have a chance of putting a 2.5 and thereafter 3. So in the event of failure, there is always an opportunity and there is a possibility that we can put a implant and thereafter which succeeds much better. Another factor, you may have very thin bone. Now what we find is that most of the developed countries like US and Europe, people, they are big in stature, they have good bone, and therefore you can drill a bigger hole. But in India, there are cases where the bone is less, or even in those countries people may have where the bone is less. Now in such cases, instead of doing a bone grafting, taking from bone from somewhere else and putting there and allowing it to heal, where even the success rates of bone grafting are not very comfortable, not very successful, and we have to take a chance putting all those. Here, we don't have to do anything of that sort. We don't need to do bone grafting. So there are certain distinct advantages which we find in these over a long period of time, as far as the strength is concerned, as far as the chewing is concerned. So from a broader perspective, it would be always advisable that we can use a single day immediate loading dental implant. That is much better than conventional, for a simple reason: patient is very comfortable, you are comfortable because you get the teeth on the same day, so you don't have to wait for that long period of time, which is not a very comfortable time for eating. So you prevent all those things. Therefore, what I normally advocate is immediate, and this immediate we had started, or myself, I had started in 1999. And now after 1999, in 2004, I made a presentation at World Congress on Oral Implants, which is the highest platform in the world at US. And there about 500 number of implantologists were present in that conference. And I found that similar to me, there have been other dental surgeons also who had done a work on this immediate loading of implants or putting on the same day. And there a consensus was developed that this is a perfect technique, and from then onwards, today we find most of the dental surgeons using this technique, taking the advantage of this phenomena of putting the same day. So one day dental implants definitely have huge advantages compared to waiting period. But if the circumstances are such that one has to use these conventional implants, then of course the success rate of both are same and can be